What is Addison's disease in Standard Poodles? Have you ever wondered what Addison's disease means for your beloved Standard Poodle? This condition, also known as hypoadrenocorticism, is an endocrine disorder. It happens when the adrenal glands do not produce enough essential hormones, particularly cortisol and aldosterone. This issue can affect both male and female Standard Poodles equally, and it is often diagnosed in dogs younger than 1 year, although it can appear at any age. The signs of Addison's disease can be quite vague, which is why it is often referred to as the Great Pretender. Common symptoms include lethargy, a poor appetite, vomiting, diarrhea, weight loss, and weakness, especially in the hind limbs. You might also notice shaking, trembling, and irregular heartbeat, increased thirst, and urination. Sometimes your poodle may seem cold or depressed. These symptoms can come and go, making it tricky to recognize early on. Addison's disease can show up in two main forms. The first is primary Addison's, where the adrenal glands themselves are damaged. This leads to imbalances in electrolytes, such as low sodium and high potassium. The second form is atypical Addison's, where only cortisol production is affected, without the typical electrolyte changes. A serious complication to watch for is an Addisonian crisis. This is a medical emergency that can cause sudden severe weakness, collapse, vomiting, diarrhea, dehydration, and shock. If you notice these signs, immediate veterinary help is essential. To diagnose Addison's disease, veterinarians typically use blood tests. The ACTH stimulation test is the most important. This test checks how well the adrenal glands produce cortisol in response to synthetic adrenocorticotropic hormone. Electrolyte levels are also measured to help determine the type of Addison's disease. Other diagnostic tools like blood chemistry, urinalysis, X-rays, or abdominal ultrasound may be used to rule out other issues. Treatment for Addison's disease involves lifelong hormone replacement therapy. This usually includes corticosteroids and mineralocorticoids. With timely diagnosis and proper management, Standard Poodles with Addison's disease can enjoy a good quality of life and a normal lifespan. Managing stress is also important, as stress can worsen symptoms. For owners of Standard Poodles, recognizing symptoms early and seeking prompt testing is vital. If your poodle shows signs like lethargy, poor appetite, vomiting, or weakness, consider Addison's disease as a possibility. Early intervention can prevent the condition from worsening and help your furry friend thrive.